Alright, let's break down another challenging medical case. Picture this. A 52-year-old man with a long history of chronic alcoholism is found unconscious in an alley and rushed to the hospital. When he arrives, he's running a high fever, 102.5 degrees Fahrenheit, and he's coughing up sputum that has a really foul smell. The team gets a chest x-ray right away. What they see is a 4-centimeter cavity in the posterior segment of his right upper lung lobe. A key finding here is that this cavity has an air fluid level. So, the big question is, what organism is most likely causing this? Let's connect the dots. We have a patient with chronic alcoholism who was found unconscious. This immediately puts him at a very high risk for aspiration. When people are unconscious, their gag reflex is suppressed, making it easy for oral or stomach contents to slip down into the lungs instead of the esophagus. This is a classic setup for aspiration pneumonia. Now, let's think about the location. The X-ray shows the abscess in the posterior segment of the right upper lobe. This is super important. When someone aspirates while lying flat on their back, gravity tends to pull the aspirated material into specific parts of the lungs. The most common spots are the posterior segments of the upper lobes or the superior segments of the lower lobes. Our patient's abscess is right in one of those classic locations. The final, and perhaps most revealing, clue is the foul-smelling sputum. This is a dead giveaway. When you hear foul-smelling sputum in a case like this, your mind should immediately jump to anaerobic bacteria. These are bacteria that thrive in loxygen environments, like the one created inside a sealed-off lung abscess. So, when we put it all together, the risk factors for aspiration, the classic location of the abscess on the X-ray, and that telltale foul smell, we're not looking at your typical pneumonia bugs like strep pneumo. We're dealing with anaerobes. The organisms that love to cause this kind of trouble are the ones that normally live in our mouths, especially in the crevices of our teeth and gums. These include bugs like Peptostreptococcus, Fusobacterium, and Bacteroid species. When these guys get aspirated into the lungs, they can cause a severe, necrotizing infection that leads to tissue death and the formation of an abscess, that cavity we saw in the X-ray. The gas produced by their metabolism, along with the tissue breakdown, is what creates the nasty smell and the air fluid level. So, the most likely organisms to be isolated from that lung cavity are a mix of anaerobic bacteria. It's a classic presentation of an aspiration lung abscess. Hope this breakdown helps you connect the dots on your next exam. It's all about recognizing the pattern. Thanks for watching, and don't forget to like and subscribe for more case breakdowns. See you in the next one.